Hello, so today we are going to discuss the dexamethasone suppression test for the Cushing syndrome and Cushing disease. Now, what happens is in a normal person, hypothalamus secretes corticotrophic releasing hormone. It acts at pituitary gland and it releases ACTH. It acts on the adrenal glands and it releases cortisol. Now, what is the low dose dexamethasone test? In this, we give 1 mg dexamethasone. This 1 mg should suppress the cortisol levels in a normal person. So, normal person, cortisol levels should go down. However, if cortisol levels do not go down, if cortisol remains normal or it's elevated, then it is Cushing. So we are done with the low dose. Now the next step is we look at the ACTH levels. If ACTH levels are suppressed, now there can be two conditions in which the cortisol level remains high after the low dose DEXA test and ACTH is suppressed. It is either exogenous. It means that you are taking steroids, and the other cause is adrenal adenoma. Now, if we see that ACTH levels are raised, then we will move to high dose dexamethasone test. In this test, 8 mg of dexamethasone will be administered. Now this 8 mg should be enough to suppress the cortisol that is released from the pituitary gland. Now if the cortisol levels are suppressed, then the issue is here at the pituitary. So when the issue is at the pituitary, we call it Cushing's disease. However, if still the cortisol levels are not suppressed after the high dose DEXA test, then it can be a lung tumor. That's all for the low dose and high dose dexamethasone test. Thank you.